make a person sick. And this comes from people that generally don't know anything about the high carb, low fat vegan diet. Essentially, there was a diet called the RISE diet, and it was created by Dr. Walter Campner. The RISE diet was created as a radical treatment for malignant hypertension before the actual anti-hypertension drugs became available. The treatment was simple: the diet and making sure that the patient stays hospitalized for a number of weeks. The RISE diet was actually founded in 1939 by Dr. Walter Campner, who was trying to escape the Nazis as a refugee and was associated with the Duke University. Campner had many patients with malignant hypertension and kidney failure, and there was no treatments back then to help these patients. Dr. Campner believed that kidneys had the following two functions: one to excrete things, and the other one was the metabolic function. Dr. Campner theorized that if you reduce the protein and electrolyte levels on the kidneys can actually perform at their best and do what they have to do to make the person feel good and recover from a terminal illness like malignant hypertension. Essentially, what Dr. Campner was doing was treating patients. They were terminal patients who were destined to die within a few weeks with nothing but rice and fruits. And surprisingly, the results were astounding. The patients improved and went on to live many, many years afterwards. The actual protocol for Campner's RISE diet was simple. They had to follow his diet and they had to be hospitalized for several weeks. The actual diet was comprised of white rice, sugar, fruit juices, iron, and other vitamins. That's it. That was essentially the diet, the RISE diet. On a daily basis, the actual RISE diet provided 2,000 calories per day, about 20 grams of protein per day, and about 700 to 1,000 milliliters of water in the forms of fruit juices per day. Sodium levels were extremely low and kept to as low as 250 milligrams per day. And last but not least, the chloride was kept to 100 milligrams per day. Campner achieved amazing results, and most of his patients actually recovered from malignant hypertension, because you have to realize that these people were weeks or sometimes even days from dying from organ failure, and this was quite a serious illness back then. Nowadays we have hypertension drugs, but still, drugs have never cured anyone, and what essentially Campner's RISE diet did was completely reverse the disease, make the patient heal naturally from the inside. The proof is there. You know, if you eat white rice, fruits, sugar, fruit vegetables, it's essentially what you need for health. We don't need fat, we don't need meat. We essentially just need a clean vegan diet that will make us heal naturally. And the proof is there. There's heaps of scientific literature written about the RISE diet and why it actually was successful. You can't argue with the facts. No one actually ever taken people and put them on a high-fat diet to cure them from malignant hypertension, because it doesn't work. The person would just die literally within days. So there was a lot of criticism of this diet, of course, back then, as with anything. Some people said it was very bland, and you know, people would struggle sticking to this type of diet because they would be bored from eating rice and fruits and drinking juice all day. But at the end of the day, that's what our body needs. It needs carbohydrates, it needs sugar, it needs that energy to keep the brain going, to keep our arteries healthy, and to make sure that we don't suffer any of those autoimmune diseases. So once again, if you follow a high carb, low fat vegan diet, you will achieve remarkable results long term. You will save your health, you will save your life, and you will live a very, very long time. Like, subscribe, and comment.